Dr. Eleanor Vance, a highly respected physician at the renowned Jefferson Clinic in Green Valley, California, has recently released an in-depth guide that explores a surprisingly common, yet frequently underestimated health concern, nocturia. This condition, defined by frequent urination during the night, is especially prevalent among individuals over the age of 60 and can be a major disruptor of restful sleep. Through her extensive research, Dr. Vance reveals that specific foods, particularly fruits, play a crucial role in either aggravating or alleviating this issue. Her guide offers a clear, evidence-based breakdown of which fruits are beneficial and which should be avoided in the evening to foster uninterrupted, restorative sleep. Understanding nocturia and its impact on sleep nocturia isn't merely an inconvenience, it's a condition that can severely impact one's quality of life. Waking up multiple times during the night to urinate interrupts the sleep cycle, leading to fatigue, irritability, decreased cognitive function, and even heightened risks for chronic conditions such as heart disease and depression. According to Dr. Vance, many people are unaware that their dietary choices, particularly their evening consumption of fruit, could be directly contributing to the problem. Through meticulous patient observation and clinical studies, Dr. Vance found that the sugar content, acidity, and water composition of certain fruits can stimulate the bladder and digestive system in ways that promote wakefulness and nighttime bathroom visits. Armed with this knowledge, she has developed a simple yet powerful set of dietary guidelines to help individuals improve their sleep hygiene naturally. 5 fruits to avoid before bed for those who experience regular interruptions to their sleep due to nocturia. Dr. Vance strongly advises avoiding the following 5 fruits in the evening hours. Each of these fruits possesses specific properties that can trigger bladder irritation, excessive urine production, or gastrointestinal activity that interferes with rest. Watermelon, known for its high water content, 92% to be exact. Watermelon is hydrating and refreshing, but consuming it late in the day can place excessive pressure on the bladder. The sheer volume of fluid it introduces into the system can result in frequent urination. During the night, for those sensitive to nocturia, watermelon is best enjoyed earlier in the day. Oranges and other citrus fruits. Citrus fruits like oranges, grapefruits, lemons, and limes are highly acidic. While this acidity is part of what gives them their signature tang, it can also irritate the lining of the bladder. This irritation can create an urgent need to urinate, sometimes even if the bladder isn't full, thus disrupting deep stages of sleep. Grapes, despite their small size, grapes pack a punch in terms of sugar and water content. The sugar can cause a spike in energy levels, while the water content may stimulate urination. In addition, grapes can also provoke bladder sensitivity in some individuals, making them a less than ideal choice before bedtime. Pineapple, this tropical fruit is a double-edged sword. For those struggling with nocturia, it has a relatively high sugar content and is moderately acidic. Both of these factors can increase urinary urgency and disrupt sleep by prompting insulin activity and acid production late in the evening. Apples, while generally considered a healthy choice, apples contain natural sugars and a high amount of dietary fiber. This combination can kickstart digestive activity and keep your gastrointestinal system active well into the night. For individuals with sensitive stomachs or sleep disruptions, apples are best eaten earlier in the day. 5 fruits that promote better sleep. Not all fruits are problematic when it comes to nighttime rest. In fact, Dr. Vance recommends incorporating specific fruits into an evening routine to support bladder comfort, enhance kidney function, and promote the body's natural readiness for rest. The following 5 fruits have properties that contribute to a more peaceful night's sleep. Bananas, rich in potassium and magnesium. Bananas help relax the muscles, including those in the bladder. These minerals also play a role in calming the nervous system, reducing the likelihood of bladder spasms or stress-related wakefulness. Dr. Vance recommends consuming a banana roughly 1 hour before bed for best results. Cherries especially. Tart cherries. Tart cherries are a natural source of melatonin, the hormone responsible for regulating sleep-wake cycles. Drinking tart cherry juice or eating the fruit can help increase melatonin levels in the body, signaling that it's time to wind down and prepare for sleep. Studies have shown that tart cherries may improve both sleep duration and quality. Blueberries. These small but mighty berries are loaded with antioxidants and low in sugar. Their anti-inflammatory properties can benefit the urinary tract, and their low glycemic load means they're unlikely to spike blood sugar levels. Blueberries are also gentle on the digestive system, making them a smart choice for an evening snack. Papaya. With its soothing texture and low acid content, papaya is easy to digest and unlikely to irritate the bladder or stomach. It also contains papain, an enzyme that supports digestive health. This makes papaya an ideal fruit for the evening, especially for those with digestive sensitivities. Pears. Pears are often categorized as a bladder-friendly fruit. They are hydrating without being excessively diuretic and have a mild, soothing effect on the urinary tract. Their high fiber content is gentle on the stomach and helps regulate bowel movements without stimulating overnight digestive activity. Creating an effective evening ritual while adjusting fruit consumption is an important step. Dr. Vance emphasizes that it works best when combined with a broader evening routine designed to minimize nocturia and support healthy sleep patterns. She shares the following evidence-based practices to help individuals transform their nighttime experience. Eliminate caffeine after 2 p.m. Caffeine is a known diuretic and stimulant. Drinking coffee, tea, or caffeinated soft drinks late in the day can contribute to increased urine production and interfere with the body's natural sleep signals. Finish dinner at least 3 hours before bedtime. Eating a heavy meal close to bedtime forces the body to focus on digestion instead of transitioning into rest mode. This can delay sleep onset and increase the likelihood of waking up due to gastrointestinal activity. Avoid all fruit after 7 p.m. Even fruits that are considered sleep-friendly should be consumed well before bedtime to allow the body time to digest and metabolize the food. Elevate your legs for 20 minutes before bed. This practice helps redistribute fluids that may have accumulated in the lower extremities throughout the day. By encouraging this fluid to re-enter circulation before lying down, it reduces the likelihood of it moving to the bladder during sleep. Eat a banana and a few tart cherries around an hour before sleep. This specific combination provides both melatonin and muscle-relaxing minerals, setting the stage for a deep and restful sleep. Dr. Vance's final thoughts in her concluding remarks. Dr. Vance reiterates a crucial point. Quality sleep is not a luxury. It's a necessity for good health. Interrupted sleep, especially in older adults, can accelerate cognitive decline, worsen mood disorders, and increase the risk for falls, hypertension, and even cardiovascular events. Through her guide, she aims to empower individuals with practical, natural strategies to enhance their sleep quality without resorting to medications or invasive procedures. Simple changes like adjusting your fruit intake, timing meals, and implementing a soothing bedtime routine can produce significant improvements in sleep hygiene and overall well-being. Ultimately, the pathway to better sleep begins with awareness and intentional choices. By embracing Dr. Vance's recommendations, individuals can reduce nighttime awakenings, enjoy deeper rest, and support their long-term health in a sustainable and effective way.